to stay alive and for survival, 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 survival. Look out, peeps on WYZE, telling you about the Hip Hop Doc Posse. Dr. M.J. Collier, I'm your family physician. Please allow me a moment to dedicate my mission. The original Hip Hop Doc. Don't you deny it. Check out my curriculum vitae. I can surely supply it. Trying to take my name, sir? Don't even try it. I've been curing ills for years before you even died it. Live in the studios, WYZE. Tune in and dial up if you have a question for me. I can understand why you try to be me. A hip-hop doctor's involved in the best as far as the eye can see. I'll be...
And good evening, everyone. That is the original Hip Hop Doc single that was created by myself and Dr. Marlon B. Jackson's, Marlon Sting and B, Atlanta's best DDS. And so I was rolling through some social media and I saw that and I said, let me play that for the listeners this evening for this episode of the Your Health is Important Ask Dr. MJ YouTube, Facebook, and Instagram live broadcast. We are here to answer your healthcare questions, and this is the only interactive healthcare forum where you can call in, you can write in, you can text in, and ask your questions about any topic that you like. Ask the doctor about anything, and we are so glad to see you there. I want to say that we hope that you took advantage of our Juneteenth process that we had. We had some good specials going on Juneteenth on the Lipo-Drops website. A lot of good things going on there. People have been asking me about the Lipo Nights product. This is the product that you take in the evening, and it literally makes you lose weight while you're sleeping. It contains 3 different fat-burning type of supplements, but it also has the medication or the supplement that helps you sleep. And so you get a good night's sleep. When you get a good night's sleep, you do not have that stress hormone cortisol, which is prevalent and makes you store fat in your abdomen. So you get that abdominal fat when you're under the influence of the cortisol hormone. So in this circumstance, you don't have that. And so this Lipo Nights is really a big product. And of course, the ladies keep texting me and writing me and telling me about the benefits of their Lipo Hers and how it is boosting their sex drive, enhancing their orgasms, and just making them feel better, look better. They just feel more feminine, and they just feel like they did 10, 15, 20 years ago. So those are all products that we're so very, very proud of. The Lipo Nights, the Lipo Hers, and of course the world famous Lipo Tea that all the gentlemen are asking for. I literally cannot keep that product in my office. I run out very quickly, and I have people now that are waiting for me. I had the last bottle utilized on Monday, and so I'm waiting for a new shipment to come to my office, but it is available on the website. As always, go to lipodrops.com and you can do this. Go to lipodrops.com, Lipo Tea for men, Lipo Hers for the ladies, and the Lipo Nights for everybody who wants to lose that abdominal fat by just sleeping. And remember, weight loss now has become a phenomenon. Everybody's talking about it, everybody's doing it, and you can accomplish the type of weight loss that you like, which is permanent weight loss, majority fat, not muscle. You do not want to lose muscle with much less cost than you do by using the GLP-1s, the injectables, the Ozempics, the semaglutide type products that are available now, even online. And I see that the FDA is really having a problem with people providing these products online because you need to actually be touched. You need to be evaluated by the doctor. This is not something, it's safe. No ifs, ands, or buts about that. But it's also not something that you want to just have on, at your desire in doing so. Okay, thank you very much. Now, let's do our roll call, Halleck, and thank you so much for producing this evening's show. We're so glad that you have chosen to join us because we know you do have options, and we want to get everybody prepared for the NBA draft tonight. Everybody's wondering whether Bronny James is going to be chosen or not, or who the Atlanta Hawks are going to take with the number 1 pick, or have they traded that pick away and Adebayo just doesn't know it yet. Those sorts of things. So we'll do that. So who we have on, Heidi? Let's do it. Deborah Bell. Thank you, Deborah. I appreciate you. She says, hi, Dr. Collier. Thank you for your knowledge. Thank you for listening. My job, my objective is to provide infotainment. Good evening, Doctor. Haley from Michigan. Good evening, Carolyn Brown. Michigan, the Midwest is in the house. Mimi Witcher, good evening from Tampa, Florida. Hi, Mimi. Thank you for joining me. Okay, Sean Big Time Green from Monroe, LA, Louisiana. Sean, we appreciate you always being here, always being one of the first men that's followed. We appreciate you. Telia Starks, hello, happy Wednesday. Happy Wednesday to you as well, Telia. Thank you. She's an AKA as well. Loretta McNair, hello. We're going to give a shout out to all the fraternities and sororities. Winnie King Terrell from Terrell, Texas. Hello, Winnie. How are you? Thank you. Glenda Everett, good evening. Glenda, we appreciate you for joining us. Rosemary, good evening from Pittsburgh, Pennsylvania. Thank you, Pittsburgh. We appreciate you being here at one point, Atlanta's best city. Dr. Marlon B. Jackson, Atlanta's best DDS, Stinging B. Jackson. You've already got your props. I hope you heard me playing the original hip hop doc song that you and I created years ago. David Holiday, Columbia, South Carolina. David, thank you for joining us. You look rather distinguished in that suit, sir. I like that. YouTube user Margaret from Michigan. Hi, Margaret. Thank you so much. We appreciate you tuning in on the YouTube channel. And Linda Bloomer, Linda B. Birmingham. All right. Thank you for being from Birmingham, Alabama. Nicole Varnadu from LA. Thank you, Nicole. We really appreciate you tuning in because your time zone is 3 hours different. So it's early for you. It's just 3:30. So you're probably still at work. Anastasia Seeley. Good evening from Miami. Thank you, Anastasia. We appreciate you as well. Juanita Evans from Indianapolis. Thank you, Juanita. We appreciate you for joining us and everyone that's here this evening. Thank you so much. Penny Roberts from Henderson, Texas. Thank you, Penny. Okay, we got Texas. We got California. We got Michigan. We got Louisiana. We have Pittsburgh, Pennsylvania. And from Fort Lauderdale, Florida. Florida girl. All right. Hello, Karen from Fort Lauderdale. Thank you for tuning in. Is this your first time? I don't recall seeing that picture before, but thank you for joining us, and we hope that you will be a regular. Cherie Donald checking in from St. Petersburg, Florida. Hi, Sherry. We appreciate you. St. Petersburg, one of my favorite cities. It's Amy from Indiana. All right. Hey, it's Amy. We appreciate you. Joni Cummings from Fort Lauderdale. Okay. Joanne Cummings from Fort Lauderdale. Regina Miller from Columbus, Ohio. All right. Lisa Harris from Durham, North Carolina. Thank you for being here this evening. Okay, Heidi. So thank you so very much. For those that were listening to the Wellness Wednesday this morning on the Rickey Smiley Morning Show, Dr. Collier brought to you some great information about a new treatment for pancreatic cancer. Not just pancreatic cancer, but it's been found to be the most effective treatment for pancreatic cancer that has existed up to this point. It shrinks tumors from 30% to up to 98%. It does not damage normal tissues. This is an absolutely incredible product, and it is in research phase now. They're doing clinical trials on it, but it is shown, when they start doing a clinical trial and you get these types of results, then the FDA stops the trial. It is unethical to continue the trial and keep that product away from people when it can help so many. So once they have demonstrated safety, and efficacy, meaning that it works, this will be readily available. So we have a new weapon in our armamentarium. So if you remember, Jeopardy host Alex Trebek died from pancreatic cancer. Michael Landon, who played two characters, iconic characters on television, Little Joe on Bonanza, and he played the father in Little House on the Prairie. And so he died from pancreatic cancer. And then Patrick Swayze of Dirty Dancing fame and Ghost fame. He played in the movie Ghost. Whoopi Goldberg won a Best Supporting Actress Academy Award for that performance. And he died from pancreatic cancer. So it is very, very important that we do that. And then you have to think about it. I think that the Black Panther, the character that played the gentleman that played the character, the Black Panther, died from pancreatic cancer as well. So now prior to now, by the time people were diagnosed, it was already late stage. And that was when you do a late stage diagnosis on a cancer, you're going to have a bad outcome virtually every time. So now we don't have to worry about early diagnosis. We just diagnosis at any point. And signs and symptoms: abdominal pain, dark urine, itchy skin, jaundice. The abdominal pain feels like a pole is going through. It goes straight back from front to back. It doesn't go around. It goes straight back, and it's usually on the middle or it's usually in the middle of your stomach, near your belly button, or on the left-hand side. Whereas appendix pain is on the right-hand side. Appendix pain can start around your belly button, and then it migrates and moves down to the right lower quadrant of the abdomen. That is classical appendix pain. So differentiate that from pancreatic disease and pancreatic symptoms. So we want to make sure that you understand that. So if you have a family member, or if you have anybody, you yourself are suffering, there's new treatments that are on the way. But once they start utilizing this technology for other cancers, and I talked about this years ago, this new technology that does not damage normal cells, it only kills the cancer cells. This is incredible because the traditional therapies, radiation, chemotherapy, do a lot of damage to normal tissue as well. The goal, the objective is to try to target the cancer and get, do as much damage to the cancer while doing minimal damage to normal tissue. But sometimes that doesn't happen. And you get a lot of damage to normal tissue as well. But now, with these new classes of drugs that are protein binders and blockers and what I call biologics, they are smart bombs. They go straight for cancers and give you total and complete resolution of the disease state. So that's where we are now. So let's get to your question. This is your show. Ask the doctor anything, and we are here to talk to you. Let's do it. Melissa Ramsey, how can you tell me what can I take to lower my sugar? It's always high 500 or 600. What can I do to lower it? Melissa, you're going to have to take some medication, possibly even insulin. You are, without question, a diabetic, and sugars that high can be dangerous. You have polyuria, which is urinating a lot. You have polydipsia, which is always thirsty, which means you probably can't sleep through the night without having to get up to urinate multiple times. But that dries you out, creates a dehydration circumstance, and can predispose you to a diabetic coma or diabetic ketoacidosis, which is life-threatening. That's a life-threatening state. So you need to get that down. Sometimes when you are glucose toxic, which you are, that means your sugar is too high, you have to utilize insulin to get it under control. Once you've broken or resolved the glucose toxicity, then you might be able to control your blood sugars with up to 3 medications. Now, they used to call it, triple therapy, 3 different medicines or oral medications to control your diabetes. If that doesn't do it, you have multiple injectables now, the GLP-1s, which would be the Mounjaro and the semaglutide, the Ozempic, are indicated for the treatment of diabetes, and they will lower your blood sugar. They will also make you lose weight. They will lower your A1C and get you under control. So it's very important you also don't get cheap sugar from things like sweet tea and sodas. Sodas are off your limits now, and no sweet tea ever under any circumstances. You can drink tea, just sweeten it artificially. But your beverage of choice needs to be water, and you need to drink lots of it. When you drink lots of water, you will flush the sugar out. You will urinate out the sugar, but you will also urinate out the calories associated with that sugar. So water is your beverage of choice. And then the class of drugs, I would look at metformin is the first drug that you start on. The European model is 500 milligrams of metformin 3 times per day with your breakfast, with your lunch, and with your dinner. The American, they may give you 2,000 milligrams twice a day, or up to 4,000 in one dose in the evening, which always gives you diarrhea and nausea and vomiting. So the European model, much less dose, spread out on each meal, works very effectively. So you take the metformin. If you can tolerate it, please do. Then my next choice would be what's called an SGLT2 inhibitor. Those are drugs like Farxiga and Jardiance, or the name brands. They do something amazing. When your sugar is high, they make you urinate out the sugar. You also urinate out the calories associated with that sugar. So it literally makes you lose weight. And when your sugar is normal, it cuts itself off automatically. It's glucose dependent. So that means that when your sugar is high, it's on and working. When your sugar is normal or low, it stops working automatically. So you cannot get hypoglycemia or low blood sugar from this class of medications. It just doesn't happen. And then, of course, the GLP-1s, which are the Mounjaros and the Ozempics. So it's going to require a partnership with you and your provider to get you under control. It's probably going to take anywhere from 2 to 6 weeks to get your sugar stabilized. And that will mean what I do with my patients, I have them come in every week or no less than every 2 weeks, depending upon what I have them on, and then monitor them. It's not difficult to get the sugar back under control. What is difficult is not going back to bad habits and getting it back out of control again. So great question, Melissa. We appreciate you. Carla Lewis, can you still lose weight without exercise? Yes, ma'am. If you have not heard Dr. Collier's catchphrase, you do not lose weight in the gym. You do not lose weight exercising. You lose weight in the kitchen by monitoring what you eat. You are what you eat, and if you monitor what you eat and you eat less calories than that's necessary for you to get through your day, everybody has a basal caloric requirement. And for most people, it's around 2,000, 2,500 calories. So if you eat less than that, and there are diets that are as low as 600 calories a day, you're going to lose weight. If you exercise, you can do a very vigorous workout in the gym, a very vigorous workout. The ideal workout, you work out for 1 hour, you will burn 800 calories in that 1 hour period. But to lose 1 pound, you have to lose 3,500 calories. Most diet plans reduce your caloric intake by 500 calories a day, times 7 days is 3,500, and you lose a pound a week. This is the standard methodology for virtually any diet program that existed prior to our diet program, because calorie restriction was the only way that you could lose weight. But if we alter your metabolism so that your body is burning fat more effectively and you're not storing fat as fuel, you will lose weight without exercising as well. That is what the whole basis of the Lipo-product weight loss plan is. So if you go to the website, lipodrops.com, gather the information and see which products are necessary for you to lose weight. Of course, we start off with the world famous Lipo Drops Maximum Strength. You squirt 1 dropperful under your tongue before eating. You hold it under your tongue for 2 minutes, and it alters the way that your body metabolizes fat. It also makes you lose fat from places you cannot traditionally exercise the fat away from, like under your chin, the back of your arms, across the bra line, ladies, and of course the abdominal area. Lose the muffin top with Lipo Drops is our catchphrase. So that is the primary product. Then we have the Lipo Nights as well now. We have Keto Max, which puts your body into an artificial state of ketosis, which makes you burn fat as your primary fuel. This is the whole basis of the South Beach diet and the Atkins diet. That is why they work. So those are products that can do that. There are other products available online as well. So go to the website right now, lipodrops.com, and to get more information and you get a specialized weight loss diet plan that works just for you based on what your needs, wants, and desires are. Great question, Carla. Shawania Howard, menopause, hormone replacement therapy. A 51-year-old who need energy and sense of young longevity, interested in libido boosters. So the Lipo Hers will be a great product for you. But that is not the BHRT, the hormone. What you want is not just hormone replacement therapy. The standard hormone replacement therapy is estrogen. And if you still have a functioning uterus or a uterus period, it doesn't have to be functioning, then you put on progesterone. You add progesterone to protect the uterus from unopposed estrogen, because estrogen therapy alone can cause hypertrophy of cells in the uterus and can ultimately lead to a cancer in your breast or your uterus. So you have to take progesterone to stop that from happening. But bioidentical hormone replacement therapy, this is the magic. This is what gives you that sense of youthfulness that you're seeking, boosts your energy, enhances your libido, makes you feel like you're 18 to 20 years old, makes your vagina thick and moist. So thick and wet, that means it's now tight and wet, and enhances your responses to stimulation. So your orgasms are much more intense the way that they used to be. And if you haven't had orgasms, you need to. If you have, you may have multiple now. So all of these things are great things. Google or go on. I have information on my YouTube channel about bioidentical hormone replacement therapy, or BHRT. There are many doctors that do this now. Dr. Collier was one of the few that did years ago, but now lots of doctors do it. So the doctor will either be a primary care doctor or a GYN, OBGYN physician who provide that service for you. So check that out. It's how we want to make sure and keep us informed as to which choices you make. If you decide you want to come to Atlanta and come to see me, I'd be happy to do that for you. And we can talk about making you the best you that you can be, making you feel and look and act 20 years younger. All right, great question. Lynn F. Hi, I've lost 25% of my body weight, but need to know how to tackle sagging skin on my arms and abdomen. Okay, yeah, 25% is a great amount of weight loss. It's much better to help prevent that from happening versus once it's happening, you got the loose skin. So this is just going to take some tightening up of the muscle. You got to build some muscle to hold that loose skin, and you got to tighten the skin up. The skin needs to be moisturized. But one of the things that I tell patients when they're losing weight, you use a good skin moisturizer that contains vitamin E. E is in epsilon. That will help keep the skin nice and healthy, no stretch marks, etc. And as it shrinks, it will have a better tone to it. Massage works as well, but again, it's just good aerobic type exercise will help tighten the skin up. There is also a therapy. I have a machine called the strawberry laser lipo that tightens up skin, but it can only do so much. If it's so significant that you have just skin folds, then you might have to actually have that surgically removed. So just depending upon where you are at what stage of the game, there are med spas that have technology that can help you tighten that skin up without having to have surgery. Of course, none of this is covered by insurance. Insurance may cover sagging skin if it's resulting in, say for instance, if your stomach now has a flap and it's resulting in skin rashes underneath that and you're getting yeast infections in that area, then insurances will cover that because that is now a medical condition. If it's just strictly cosmetic with just sagging skin, most of them will not cover that procedure, which means you got to be prepared to spend the money to get it done, or like I said, go to one of these med spas that has various technologies that can help you tremendously with skin sagging. But I would start off with the low-hanging fruit would be the strawberry laser lipo, LASER-LIPO. Dr. Collier has that machine in his office. If you Google that, it will direct you to somebody in your area that has that technology and see how you respond to that. You'll get the best response in the very first session. You'll start off, you'll get a session, you'll get measured before, and within 30 minutes, you'll get measured and you will have lost inches. The skin will be tight and you'll feel and look much better. But then to maintain that and to benefit even more, you'll need anywhere from 6 to 8 sessions. And so it just depends on, you have to be able to get those sessions no less than 2 times per week. Ideally, 3 times per week gives you the best response. But if you say, well, I can't go but once every 2 weeks, you're wasting your time, you're wasting your money. You're not going to get a lot of good benefit from that. Once you start to get that skin to shrinking, you have to stay on top of it to really get the maximum effect. Great question, Lynn. All right. Lemonade sparkles. I love that. Can hernia repair itself in men? No, it cannot. What a hernia is a defect in the abdominal wall. The most common area for men is in the groin area, either on the left side or the right side, sometimes both. And it's at the point where muscle tissue is covered with a covering that's kind of like saran wrap called fascia. And then when the muscle is no longer there, the fascia comes together and attaches to the bone to hold that muscle in place. And there's usually some slippery substances in there to keep the muscle sliding back and forth so it doesn't generate heat from your normal body movements. So when that happens, you get a defect in the muscles, and that defect is a hole, usually where the fascia attaches to the muscle or someplace where it's thinned out. Once that hole is there, it will not repair itself because the fascia is not a tissue that is restorative. Once it has a hole in it, it has to be fixed. And so people can get them in their belly button. You can have an umbilical hernia. You have heard of innies and outies. If a person is an adult and they have an outie, they have an umbilical hernia, that needs to be fixed. I used to do that procedure. You kind of create a little smiley face incision at the bottom of the umbilicus or the belly button. You sew it with some sutures. Now they're putting mesh in some people as well. So the mesh will help stabilize so that it doesn't reopen and tear. But this is a surgical problem. While you're sitting there talking about it, it's best to do it versus it becoming an urgent problem, because that hole will allow a loop of intestines to come out. Now, if that loop of intestine goes back and forth, that's called a sliding hernia. That's okay. But if it ever comes out and gets stuck or twists on itself, now you have a bowel obstruction and you have a medical emergency that literally worsens on a minute-to-minute basis. So if you can get it fixed by choice, i.e. you go to the doctor, he confirms you actually do have a hernia, and then says, okay, we can fix this on Friday. You come in Friday morning, you'll be home by lunchtime, you'll be totally healed in a week or two, and the only restriction will be no heavy lifting or something like that. Then you have a good, quick, and easy recovery. If it ruptures, then you got a disaster. It's kind of like you got piece Humpty Dumpty back together again. You have all these pieces of tissue. You either have to pull it back together or cut out. And once you cut out, then you got to close that gap. And so that becomes what would have been a minor surgical procedure now becomes a much more aggressive surgical procedure, or even a major surgical procedure if you get a loop of intestines trapped in that hernia. That loop of intestine dies. They have to cut out that bad piece of intestines and then reconnect the ends of the intestines. Oftentimes, people will have leaking, with problems associated with it, and so it's best to just do it while everything is where it's just a hernia, and that's the only problem. And so you need a general surgeon is the person that will do that. You can get evaluated by a primary care doctor, your family doctor, or your internist, who can refer you to a surgeon, and the surgeon can take care of that for you. They're using laparoscopic techniques now, meaning they have to make fewer little tiny incisions. You don't get big scars all over yourself. And it's very, I won't say it's minor surgery. I had a patient educate me. I was explaining to him. I say, oh, it's just a minor surgical procedure. And he said to me something that was very profound. He stopped me, looked me in the eye, and said, Dr. Collier, there's no such thing as minor surgery when you are the person being operated on. And I said, you know what? You're absolutely correct. That was the greatest, most profound statement I had heard. So I utilize that now. So I never say minor surgery. I just say less invasive or minimally invasive, or something that you can recover from very quickly. Great question, Lemonade Sparkles. We appreciate you. JW, my doc did not warn me about insulin weight gain. What can I do to stop it? You cannot. Insulin doesn't make you gain weight. What insulin does is make you hungry. You eat more and you gain weight. Now, when you're a diabetic, you're on insulin, the doctor is telling you to eat less, but he's giving you a medication, insulin, that makes you hungry and makes you eat more. That is why most people with diabetes, they lose weight when they're first diagnosed, because they don't know what the problem is, that high sugar creates a catabolism or catabolic situation where your body literally is eating itself, so you lose weight. People get scared. They think they have cancer. They think they have HIV or AIDS. And so they don't want to go to the doctor to get checked. They go to the doctor, they get checked. Doctor said, oh, your blood sugar is 600. You have diabetes. And they're literally relieved that it is, quote, just diabetes. But that's a life-threatening circumstance. Now, to get out of that glucose toxicity, you would have to use insulin. But you don't necessarily have to stay on insulin now. There's so many treatment options available. I take people off and get people off of insulin on a regular basis. But if you have type 1 diabetes, you will need insulin. If you have burned your pancreas out, meaning you've had diabetes for more than 15 or 20 years, because it's thought that by the time you're diagnosed with diabetes, you have already had diabetes for 3 to 5 years. You just didn't know it. When you, as your pancreas is burning out and making less insulin, you need to replace that insulin. So that is why the problem is, unless you get like an insulin pump, if you're taking insulin shots, then it's going to probably result in weight gain, unless you are just very, very strict about what you're eating. You have to really maintain a healthy diet. You have to make sure that your portions are low, and you have to monitor what you're eating. Since most people don't do that, you end up gaining weight. So that's what the problem is, JW. But there are things you need to talk to a nutritionist to help get your diet under control, and ask your doctor about other options besides insulin that not only won't make you gain weight, but probably will help you lose weight, like the new GLP-1s, like the Ozempics, like the Mounjaros. Those medications, again, I've been successfully removing people off of insulin, put them on those drugs, get the diabetes control, lower their A1C, and they lose phenomenal amounts of weight. The weight loss with those drugs is 20 to 30 pounds per 100 pounds of weight. That is the equivalent to having had a gastric bypass surgery without the surgical risk, without the surgical recovery time, and without rewriting your plumbing permanently. That results in a whole lot of problems and side effects, particularly depending upon what you eat. So JW, you need a partnership with your doctor. Get a nutrition consult. Doctors don't have nutritionists in their office now routinely because insurance won't pay for their services. So you'll have to get one that's affiliated maybe with the hospital, which sometimes will do nutrition counseling for diabetics for free. Or public health center as well. Public health center, federally qualified community health center, or a major hospital system. Just call and ask, do they have nutrition counseling for diabetics available for you? All right, great question. Carol asked, a good evening, Carol. What can you do for a frozen shoulder? Put it in the microwave. No, a frozen shoulder is where you have had inflammation in the shoulder, usually due to a traumatic injury that results in arthritis, and the arthritis causes what's normally a flexible joint in the shoulder. It's a ball and socket joint, and your shoulder can move around. Unlike any other joint in your body, its range of motion is very, very good. But when you have had traumatic injury to the shoulder, they put you in a splint or a arm cast that holds your shoulder in place. As this is healing, then the smooth areas that used to glide easily back and forth in all directions for your shoulder now can become solidified and decrease range of motion. It can actually even heal as if it was a broken bone, and now the bones lock up. So you literally have to sometimes be placed under general anesthesia. They put you to sleep and they start manipulating that arm. It requires multiple sessions sometimes. Sometimes they can do it in one. And they basically break what they call adhesions in the shoulder, and it restore that motion. Now, you still have to go through physical therapy because as it tries to re-heal from that traumatic stretching, strengthening, then you're going to have that problem. So it can re-heal and do the same thing over again. So it's a process in doing so. Where frozen shoulder sometimes will ultimately result in you having to get a shoulder replacement, just like a knee replacement or a hip replacement. They're now doing shoulder replacements to restore that full range of motion. But physical therapy is the first way to go. Manipulation under anesthesia is the second level of therapy, and then surgical replacement will be the third level. So work with your orthopedist and your physical therapist. Do those things they tell you to do. The thing about physical therapy is this. People go to physical therapists to do great, and then they go home and don't do anything. The physical therapist, they'll say, I took therapy for 6 weeks and then I stopped going. Well, they dismiss me. The problem is once they have taught you what to do, then you do that, whatever that is, while you're in the comfort of your own home. If they said move your shoulder around like this or your finger like this or whatever they told you, while you sit there Netflixing and doing other things at home, do those exercises. Do those exercises 2 to 3 times per day, and you will optimize your recovery from your traumatic injury. It's only because your physical therapy time is going to be metered. An acute injury, they may let you go 3 times per week. They may let you go anywhere from 2, 4, 6 weeks. But after that, the insurance companies are going to stop paying for it. The physical therapist miraculously declares you healed and says you don't need to come back. Well, it's not that you don't need to come back, it's that they're no longer getting paid to see you. And so unless you're willing to pay anywhere from $200 to $500 per session for physical therapy, then you need to learn those exercises that they taught you how to do, use those apparatuses, whatever they are, and get yourself together. Okay. There we go. Dr. Kai is getting a little choked up there. Next question. Katrina Wade. When taking the Lipo-Drops Max before 3 meals, can you also take the Lipo Nights before bedtime? Absolutely. That is the optimal weight loss objective right there. So the Lipo-Drops can be taken once, twice, or 3 times per day. For maximum weight loss, you take it 3 times per day, basically before each meal, your breakfast, your lunch, and or your dinner. The thing is, make sure that you're taking the Lipo-Drops Max correctly. I've had people call me, write me, DM me, and say, I'm taking the Lipo-Drops and haven't lost weight. What they're doing is squirting the Lipo-Drops on their tongue and swallowing it immediately. That is not how the Lipo-Drops work. The Lipo-Drops work correctly by being absorbed sublingually, which means under the tongue. You squirt it under your tongue. You go under the tongue. You squirt the dropper full. The dropper will draw up the perfect amount every time you squeeze the dropper. It sucks up the exact amount of Lipo-Drops Max that you need. Squirt it under your tongue. Hold it under your tongue for 2 minutes. That is where it is absorbed. It is effective as taking an injection. It is absorbed that way, then you swallow it. It does absolutely nothing inside your stomach. Your stomach digests it, and you get no benefit whatsoever. It's only under the tongue that it is absorbed. So you do that before each meal. Then the Lipo Nights, and there's videos on our website, on the Lipo Drops website, that show you the correct technique for taking the Lipo Drops. Because this is a big question and a problem sometimes. You want to make sure that you're taking it correctly. The Lipo Nights is just 2 capsules anytime after dinner before bedtime that will have that amazing benefit of giving you a good night's sleep, as well as the 3 different fat burners that are in there that will help you lose weight and burn fat overnight. This is an actually incredible product. A couple of the components have been around for a while, and what we did was combine them all in one pill and then add the melatonin so that you get a good night's sleep, because we realize that most people do not get good night's sleep. And if you're not sleeping well, you're tossing and turning, you're going back and forth, or you're getting up to go to the bathroom, you're breaking your sleep cycle. You're breaking your sleep cycle, you're getting cortisol hormone levels high. That results in increased abdominal fat and poor digestion of your food. Just storage of your food as fat, usually in the abdominal area. So now all of a sudden you get a good night's sleep and you're burning fat. You're literally, I mean, this is about the best option you could have for weight loss. The combination of the two is really going to be effective for you, in addition to a couple of other things that Dr. Collier recommends. I personally take the probiotic and the Lipo Cleanse every morning and every evening. I brush my teeth, I take the Lipo Drops and Lipo Cleanse. That keeps your colon empty, keeps your abdominal, keeps your GI tract moving forward. You will have large, easy to pass bowel movements that are removing toxins, removing fat, removing weight from your body. Very, very important that you do that, because as you start to lose weight and the fat breaks up, so to speak, it's releasing anything that's stored in the fat, and a lot of toxins are stored in your body's fat layers. So you want to move that out of that. So you want to detoxify yourself by using the cleanse and the probiotics, which stabilizes your GI flora and keeps you going. So I have really been happy with the response to that. Keeps your stomach flat, because a bloated belly is different from a fat belly. You can have a fat belly, lose fat, and still have a bloated belly. So if you want to have a nice flat stomach that's very attractive in your clothes, then you want to keep the bloating down to a minimum, and you want to keep the colon empty. Some people have bowel movements once every 4 or 5 days, sometimes just once a week. But you're eating 3 times per day. Where do you think all that is going? It's bulging your abdomen out. The Lipo Cleanse, which is not a laxative, I have to emphasize that. It does not give you uncontrollable diarrhea that you have to run to the toilet and you're not sure you want to be at home versus being at work. It doesn't do that. All it does is basically is fiber, which gives you, again, keeps the stool moisturized, stops it from becoming dry and hard, increases the bulk of the volume. So you have largest stool you've ever had, fills your toilet up, easy to pass. And then you have that sense of, wow, my stomach is empty, my stomach is flat, I feel great. So, and that's one of the things that, again, I do that every day. I also take Dr. Collier's Trio, which includes omega-3 fish oil and the vitamin D3, the doctor's D. And again, I already mentioned the probiotic that we take on a daily basis as well. So all of these are things that optimize your health, make you look good, feel good, give you energy, keeps your skin clear, everything you can possibly think of as a benefit. Perfectly compatible with any medication that you're taking, this or any disease state that you have. If you have high blood pressure, if you have high cholesterol, if you have diabetes, you can take any of these products safely without any consequences or problems. And they will usually result in improvement in either of those conditions, because you're losing weight, you're feeling better, you're sleeping better. So your blood pressure goes down, your cholesterol levels decrease, and your blood sugar is easier to control. These are what people are asking me always. What can I do naturally, Dr. Collier? I don't want to take another pill. These are what you can do naturally. These natural supplements will optimize your health and minimize the problems associated with these disease states. Okay, great question, Katrina. YouTube user. I suddenly started having poor circulation in my legs when I lie down at night, so poor I can feel the pain in my toenails. What is this from, or what can I do? I'm a healthy person overall. Could be just lying down. It could be postural. Sometimes, particularly if you lay on your side, your circulation, your veins cannot tolerate your body weight anymore. They could in the past, but now they can't. So what often happens, the person sleeps on one side, they get restless legs, they feel problems in their feet, They cannot get comfortable, so they turn over, go to the other side. So they basically spend all night trying to find a comfort zone. The ideal posture for sleeping is lying flat on your back with some support in the small of your back and some support under your knees so that your legs are flexed. Instead of your legs being straight like this, you want something under the knee that allows the leg to bend down about 15 to 30 degrees. That is the relaxed posture of the leg, and all those muscles can relax, and then you'll feel better. So it's very difficult. Dr. Collier clearly understands that it's very difficult to change your sleep posture when you've been sleeping a certain way all your life. But when you do that, you will find that it gives you almost immediate relief from this. Also, stretching your legs out before you go to bed at night. That's standing approximately 1 foot away from the wall. Fold your arms on your chest, lean your chest, and put your arms on the wall, leaving your heels flat on the ground, and you will feel everything from your thighs, your calves, your buttock, everything stretching out, and hold that posture for about 10 seconds, and then relax, and you'll see that will help you tremendously as you progress through the evening. Great question. X Berry, hi Doc. Wondering for African Americans. I know the difference between vitamin D versus D3, but which works best? Okay, vitamin D, there's a D2, which is the inactive form of vitamin D. Your body converts D2, the inactive form, to D3, which is the active form. The problem is that some people do that very efficiently. They can take D2 and it converts to D3 almost immediately. Some people do it good, but not very well. So they will get some D2 converted to D3. Some people don't do it well at all. So they're taking D2 and getting none of the benefits because it's not actually being converted to D3. That is why Dr. Collier says, cut out the middleman. If you have difficulty or if you need D replacement, if you need vitamin D supplementation, take the one that's going to work. It doesn't matter how well you metabolize it one way or the other if you're taking the D3 because it's already the active form and ready to go. So that is why my doctor's the doctor's D, vitamin D product works so well because it gives you the optimal dose of 5,000 international units per day in the active form, which is D3. I see, actually, FDA only recommends about 400 to 600 international units of vitamin D per day. Totally ineffective dose. Totally ineffective dose. That'll stop you from getting rickets and breaking your bones, but it won't do much of anything else. 5,000 international units a day optimizes. You have healthy bones. You have healthy teeth. You have healthy skin. You have healthy hair. You have optimized immune system function, so you are not as susceptible to infectious pathogens. So no viral infections like the flu or the coronavirus, no bacterial infections like strep throat or pneumonia, no fungal infections like toenail fungus, fingernail fungus, jock itch for men, vaginal yeast for women. These things just cannot survive in your body when your vitamin D level is where it needs to be, which is the normal range is 30 to 90, but ideally you want it to be between 60 and 90, and the only way to achieve that is to take an effective dose, the effective dose being 5,000 international units per day. And there are many, many studies linked with vitamin D therapy in cancer prevention. First thing that happens when a person gets a cancer diagnosis, they're placed on high-dose vitamin D. It won't cure the cancer, but it'll slow down the growth and make your body an unfavorable environment. But why do that when you can prevent it up front? Take the vitamin D, and then you are less susceptible to cancers. And the ones that have been studied, colon cancer, breast cancer, prostate cancer in men, but the same mechanism should work in virtually any cancer. They just haven't done studies in 100% of them. But they have shown that no matter what your cancer diagnosis, they place you on vitamin D therapy. So vitamin D3, that's why you take the D3 X-Berry versus the D2, which is, again, can be effective in a lot of people, but D3 is effective in everybody. Great question. April Shanta, I just started taking the drops about 2 weeks ago as well as the Lipo Night supplement. Already love them. Thank you, April. You're getting scared to get your section back. I want to know how long you can take the drops. You can take the drops forever. Dr. Collier takes them routinely. Now that I've accomplished my weight loss objective, I'm down 30 pounds, I don't take them as regularly. I was taking them 3 times per day. Now I may just take them in the morning after I brush my teeth, routinely. But if I feel like I had a big weekend, I went to the game and I ate a lot of wings, or I had more alcohol than I traditionally will do, which can result in weight gain, or if I just step on the scale and I see I've gained a couple of pounds, I don't wait until I've gained 5 or 10 pounds. If you gain less than 5 pounds, you can knock that off in a week, a weekend. It's not even real weight. I don't call it real weight. It's not stuck to you yet. But once you're over 5 pounds, you have real weight down. It's going to be very difficult to lose again if you've lost it once, because every time you lose it, it becomes more difficult to do that. So what you want to do is put yourself on a maintenance program that works for you. That may be just taking it at night. That may be just taking it with your breakfast meal or whatever your largest meal of the day is. But there's no downside to taking it every day with every meal. What happens then, your metabolism will be optimized, and you will find that you'll be able to eat more and won't gain weight because your body is metabolizing the food instead of turning it into fat. So the maintenance program varies per individual depending upon how much you eat, how much you like to eat, and how often you eat, and what you're eating. But again, the answer to the question is, how long can you stay on the drops? You can literally take them forever. You don't ever have to stop as long as you want to optimize and maintain your weight loss. But you do not have to. Once you have attained your weight loss goal, if you can keep the weight off by monitoring what you eat, doing some aerobic exercise to keep your metabolism elevated, then you won't have to take them again. But I would recommend keeping them around so that if you find that 2 to 3 pounds has stuck onto you, you start using the drops again immediately and get rid of that in real time. Okay, great question, April. Penny Roberts, I have yet to be diagnosed, but I have a neurological and musculoskeletal disorder. What could this be? Penny, so many different options, anything from MS to lupus, fibromyalgia. The problem is that there's no diagnostic test that determines exactly what the disease process is. Most of the time, these diseases are diagnosis of exclusion, which means that we ruled out that it's this thing, and so now it must be that thing, or we're going to call it this. For instance, there's no lupus test that says, okay, this is lupus and nothing else. There is no test like that. There is no test for fibromyalgia. Fibromyalgia is a diagnosis based on your symptomatology. So the doctor has to listen very carefully as to what your signs and symptoms are, then come to the conclusion that you have fibromyalgia. But it doesn't necessarily have to do that. It may not necessarily happen that way. So you need a good primary care doctor on your team. You need a good possibly neurologist and or a rheumatologist. This is going to have to be a team approach. You need to make sure that all of these doctors are communicating with each other, and so that and not just running with one diagnosis. I had a patient today, a case study, that had shingles, broke out on the back. And so very painful when it happened. So he was taking pain medications, anti-inflammatories. And once the doctor took him off pain medications, he was using patches to control the pain. And the pain was going on there. He's going into the 2nd year. Imagine hurting like that for over a year. And he finally went to the doctor, a new doctor. The doctor looked at him and saw that the pattern of the area where he was hurting was exactly the pattern of the patches that he was putting on. So the problem was he was not having post-herpetic neuralgia. What he was having was an allergic reaction to the patches that he was using to control the pain. Once they were stopped, within 2 weeks he cleared up and been symptom-free ever since. But it took someone with a fresh, new perspective. The problem is once you go to a doctor and get a diagnosis, if you go to somebody else and they see what that diagnosis is, they ride with that. Sometimes they don't do an individual assessment. That's why sometimes a second opinion is a total waste of time, because if somebody has already given you a diagnosis, and don't let it go into your medical records or on your hospital records, because then you have that and that only. Nobody else is really even looking for anything. I have to tell when I'm doing lectures to other physicians, I have to say, remember, you're the smart kid in the room. If it doesn't make common sense to you, or just because somebody says it loudly and with enthusiasm, doesn't make it right. Sometimes you have to do an independent assessment to see and to make the correct diagnosis of the patient. So be patient, communicate with your healthcare providers, make sure that you have a dialogue going back and forth. Don't let them fast talk you or just quickly push you aside, because this is a diagnostic dilemma. Some people don't like that challenge, and they got other people to see. So they'll just, placate you with, a new medicine, a new muscle relaxant, a new pain medication, and then move on to the next person without really trying to give you the time and attention that you need. So make sure that you're being evaluated by a team that is working to optimize your diagnosis and optimize your outcome so that you can be the best that you can be through this penny. Thank you very much. We appreciate that. Shannon Reed, I have rheumatoid arthritis. What can I take besides the methotrexate and ibuprofen to relieve inflammation and pain? Okay, ibuprofen is a class of drug called an NSAID, a non-steroidal anti-inflammatory medication that calms down the inflammation. So it's one of the drugs of choice. There are multiple anti-inflammatories that can do that. 1 second, please. Hold on. Okay. Now, there are new medications called the biologics. Enbrel is one of the ones. There are pills, there are injections, there are infusions. All of these things work wonderfully for rheumatoid arthritis. They totally relieve all the symptoms. They do no harm to your normal tissues. But it has to be one in the doctor's vocabulary, and it has to be a medication that they feel comfortable using. A lot of doctors will just use methotrexate and ibuprofen because that's what they've always used. It does give you symptomatic relief, but there are much better products out there. So the doctors take care of you. Sounds like you're under the care of a rheumatologist because you're on methotrexate. Tell them, I'd like to try something new. I'd like to see if there are any other options besides the methotrexate. Again, oftentimes because they're familiar with it and because it does work, does give you some great benefit, but it's not the same level of relief and response that you get with some of these newer products. Because remember, rheumatoid arthritis not only causes joint pain and inflammation, it literally does damage and destroys joints. So you get joint deformities, loss of range of motion. Your hands don't work as well. Your knees don't work as well. None of your joints work the way that they could optimally. So you want to make sure that that's not an issue for you. The biologics just correct your body's local immune response so you don't have the inflammation. Other things you can do naturally. The omega-3 fish oil that we have, the Lipo-Omega, is amazingly good for literally like oils the joints, for lack of a better way of putting it. But it's a great natural anti-inflammatory as well as getting your vitamin D level up to the optimal levels. So taking the doctor's D, 5,000 international units per day, that combination is great. Vitamin D is your body's natural anti-inflammatory. Omega-3 fish oil is a great supplement to helping your body decrease its internal inflammation. And so you can add that to any of those medications that you're already taking, regardless of whether you get one of the new biologics or not, and get some great relief for your rheumatoid arthritis pain. And because this is a chronic disease and it is a progressive disease, if you don't control the inflammation now, it will get worse and you will end up with worse joint deformities. And sometimes they actually have to do joint replacements in the hands and the fingers, the ankles. And you don't want to do that if you can avoid it by doing a little prep right now to prevent that from happening. Okay, Shannon, great question. It's Amy. All right. What is the best blood pressure medicine? No issues with sugar. Okay, Amy. There are multiple choices to that question, depending upon age, size, weight, sex, all those things. It's here there. Okay, so the class of drugs that I like to use are angiotensin receptor blockers. There are about 15 of them on the market now. What they do is block the effects of a hormone that makes your blood pressure go up under stress. If that hormone is not present, they literally don't do anything, which is why they have zero side effects. They do not bring your blood pressure down. They stop your blood pressure from going up, which is a very important and significant difference in how you respond to your blood pressure therapy. So angiotensin receptor blockers will be my first choice. Then there's medication. There's one called amlodipine, a brand name Norfast, comes in 2.5, 5 milligrams, and 10 milligram doses. one of the most effective blood pressure medications in African Americans. I like to use that because it is a vasodilator. Calcium channel blocker is the formal term for it. But what it does, if you have a vein that's this size, it makes the vein this size. So you have this size versus this size. So you have this side, the amount of fluid in there or blood is fixed. You open it up, you have bigger pipes, same amount of fluid, less pressure. That is a great response as well, particularly for men, because the mechanism of erection is one of blood flow. So if you have bigger pipes going into your penis now, you get more blood going into the penis, so you end up with longer and harder erections. No one ever complains about that as a side effect, but that is technically one of the side effects of that class of drugs. So that's a good thing. That's why I like to use them, particularly in my male patients, but it works well in women as well. So that combination is my go-to under most circumstances: an angiotensin receptor blocker and a calcium channel blocker. Then there are beta blocker class drugs like metoprolol and toprol. There are specific beta-1 receptor blockers called Collier, carvedilol, and bistatic nebivolol. Those are once or twice a day drugs that can control. Then there are alpha blockers that literally block the response in your brain in reference to how your blood pressure is controlled. So there are multiple choices. And so the question and the concern is not necessarily the one best blood pressure, it's what best blood pressure medicine for the patient. And so the decision is to take a medicine. And I've had people say, okay, Dr. Collier, I didn't want to take any medicine, but now I'll take this. But I want you to give me the lowest dose possible. Well, that's not smart, because what the low dose does, the decision is to take the medicine or not to take the medicine. What you want to do is take an effective dose, one that gives you control of your blood pressure with minimal or no side effects. That's what you want. That's your objective. Just taking a medicine that's not strong enough to give you that benefit is a waste of time. So it's important that you get on the right class of drug at the right dose. This is an art, not necessarily a science. It's one that a lot of doctors are particularly good at. I like to think I'm particularly good at blood pressure, controlling it, particularly in African Americans, because I was especially sensitized to it by a few of my mentors who were cardiologists. And they taught me the ins and outs of controlling blood pressure. And then where I went to school at the Medical College of Georgia, they did the studies on receptors, peripheral receptors that make your blood pressure go up. The alpha receptors, the beta receptors, all those things. We didn't know anything about that. But the doctors that did that science were at the Medical College of Georgia in Augusta. And that's how now the basis of every blood pressure medicine is out there. So work with your doctor and do it. So it may take, the first time is not the right time. I usually see my hypertensive patients every 2 weeks until I have them controlled, and we alter the dose. The objective is to start low and to go slow. But if your blood pressure is a certain level, I know it's going to take 2 to 3 medications to control it. Don't be surprised at that. Very few people are controlled on one blood pressure medicine. Most people require at least 3. And sometimes you can get combination medicines. There are pills that have 3 things in one pill. But the most common, though, are to take one that has 2 things in it, a low-dose diuretic, hydrochlorothiazide, or chlorothalonone, in addition to the parent product, which in my case is usually the angiotensin receptor blocker. So this is going to require a little education on your part and the provider's part to make sure that you come up with a regimen that is ideal for you. Okay. All right, Amy, that will be our final question, Heidi. We're going to close it out there. I want to get everybody to go to the website, lipodrops.com. Take advantage of the products that are there to optimize your health. We have supplements that help with your cholesterol. We have supplements that help lower your triglycerides. We have supplements that alter your GI tract, your food allergy, your asthma, your skin allergies, your eczema. All of those things are dependent upon the gut flora. So that's why the probiotics are so good and so important in your normal health. The weight loss products, of course. We have the Lipo Drops Maximum Strength Formula. We have the new Lipo Nights. We have the Keto Max. We have the Lipo Cleanse. We have the Lipo-biotic and other products, the Lipo Herbs for the ladies, the Lipo Tea for the men. All of these things were developed to optimize and make you the best you that you can be. That brings to an end this episode of the Your Health is Important Ask Dr. MJ, YouTube, Facebook, and Instagram live broadcast. We'll see you next time. Be there. Tell your friends. Everybody tune in. It's summertime. While you're doing nothing, do something. Do something. Get educated. Get your infotainment here with Dr. MJ Collier. We'll see you next time.